I'm Dr. Shashibala Bhonsale, Obstetrician and Gyneacologist. Today, many people have been asking me about normal delivery. What is normal delivery? And why do some people end up in cesarean section? So, to begin with, normal delivery is the process by which the baby delivers per vagina. It is simple, safe, and very natural. So, how do you identify normal delivery? See, problem starts when you reach the hospital late or when you do not recognize the symptoms. So, whenever you have pain, that everybody knows, you start getting pains in the lower part of abdomen radiating to the back, and some little blood mixed mucus is there, then you must go to the hospital immediately. Secondly, if there are no pains, then in that case you have leaking. Then that case also you have to rush to the hospital, because when there is leaking, it means the bag of membranes has ruptured and you might go into dry labor, which will make the baby stuck and there will be problems in the normal delivery. And number 3, when there are no pains, no leaking, but only bleeding, that is a very dangerous situation. That time also you must rush to the doctor. So, whenever you reach the hospital, you are in first stage of labor. Labor has 3 stages, 1, 2 and 3. Now we are including 4th stage also. When first stage, that is the latent stage, in that case, the cervix, that is the lowermost portion of the uterus, the mouth of the uterus, that starts to open, and it goes into full dilatation from 3 centimeters to 10 centimeters. Your doctor will say that you are now 3 centimeters. That means the labor has begun and it is just starting. And by the time you reach 10 centimeters, you enter into the 2nd stage of labor. At that time, the baby starts to descend and baby comes out in the 2nd stage of labor. And the 3rd stage, when the placenta comes out, that is known as the 3rd stage of labor. And 4th stage, for observation, when you are in the labor room and we observe after the delivery if there are any complications. And at this time only we have started giving breastfeed also. We keep the baby to the breast so that suckling reflex will help in expulsion and contraction of the uterus. So that is the 4 stages of labor. Once that is done, no problem, you go into the postnatal ward. Now, in primary cases, we give episiotomy. Episiotomy is a sort of small lateral cut we give so that the baby, when it comes down, it does not tear your perineum. Now, how to take the pains? Whenever there are pains, first stage, we expect the patient to be ambulatory, because the bearing down pains, if you are standing up, are better than lying down. Okay? But if there is leaking, then we might start, we have to augment the labor so that the baby comes out before it inhales ingest all the liquor. Now we were discussing cesarean section. People are apprehensive of cesarean section, but there is nothing to fear. Cesarean section, if it is elective, which we usually take, some indications are there, like if you are a preemie with twin pregnancy, or you are a preemie with a breech presentation, or you are a preemie with some problems in the vagina, or you are a preemie with CPD. CPD means you have a narrow pelvis, then you have to go in for cesarean section. Or if you have leaking, premature, if you dry labor, then you have to go in for cesarean. Now, some are the emergency situations when the head gets stuck in the pelvis, obstructed labor, or the baby is complex, referred from some place, or the baby has lost all the liquor. So, all these things will end up in cesarean. But cesarean section is not to be feared. It is as simple as, see, if you have a stone in the bladder, you get operated. If you have an appendix, you get operated. So, it is a baby which is in danger. So, you have to get operated for the betterment of the mother, well-being of baby as well as the mother. And nowadays, so many newer methods are there. Anesthesia is there. You don't feel the pain. You are in the best situations. With all neonatal ICUs are there. So as soon as you are taken into the OT, you deliver, and it hardly takes 20 to 40 minutes for the pregnancy of the cesarean section. And 3rd day you can eat everything. Fifth day you are up and about, and we are also discharging the patient on fifth day, and by 8th or 10th day we cut the stitches. Now once the stitches are cut, go home, go home with the baby, you take care of her, you can breastfeed her, and you must have a binder also, so that you don't there's some support to the stitches and your abdomen is lax. It will take at least 45 days for the uterus to come back to normal position. So you must not exert much, you must take good hygiene, good care, you must post-operatively, you must eat well, so that you don't get, because in normal delivery we lose 500 ml of blood, in cesarean delivery we lose 1000 ml of blood. So the difference is there, you feel weak, but your body is attuned to that, and in 7 days primary healing takes place and you are alright. So only thing what you have to check is your hygiene. You should not get urine infections, and you should be careful about contraception after 1.5 months, because you must not get pregnant immediately after cesarean section. We advise the patients to at least take a second chance after 3 years, so that skin stitches they get healed, but the internal stitches they take time to heal, and we do not want to put the uterus at risk if you have consecutive pregnancy in after a very short gap. Okay, so that's it. If you have any other problems, if you have any other questions, you can always WhatsApp to me, and I'm there to answer all your questions.